Thank you very much, Dr. Tedros. Let me now open the floor.
For all of these reasons, I have decided that the global monkeypox outbreak represents a public health emergency of international concern.
Tim Nguyen, who is the unit head for high-impact events.
And there are now more than 16,000 reported cases from 75 countries and territories and 5 deaths.
WHO SAGE have looked at the policies for you.
WHO's assessment is that the risk of monkeypox is moderate globally and in all regions, except in the European region, where we assess the risk is high.
Thank you very much, Dr. Ryan. And all with this, we move to the next question.
Although I'm declaring a public health emergency of international concern, for the moment, this is an outbreak that's concentrated among men who have sex with men, especially those with multiple sexual partners. That means that this is an outbreak that can be stopped with the right strategies in the right groups.
Good morning to everyone. I would like to know, since the vast majority...
We know that from the countries that are reporting cases at the moment, roughly half of them have already secured access to this vaccine. For those other half, we don't know for the moment. We have some information that some of them are in discussion with the manufacturers to procure this vaccine.
Thank you very much. And Dr. McRyan, please.
And just on the specifics of risks.
When this vaccine is given in a pre-exposure context, it is not like giving an antiviral. It takes time for vaccines to work. And in this case, it can take up to 3 weeks, I believe, for this vaccine to take full effect. So being vaccinated does not give you instant protection. The best way to avoid this infection is to avoid being exposed to it. And if you are exposed to it, to avoid being the person that transmits that further to somebody else.
Today, News Africa in Washington. Dr. Tedros, you said again that no...
Of course, as I said earlier, since the role of the committee is to advise, I then had to act as a tiebreaker. I consider this as a clause and no consensus by them. So my colleagues and myself discussed about this issue, and we believed that it's time to declare FIC or public health emergency of international concern.
Very simply, is it too late in your assessment to control this